Hello, and welcome to A Path Forward. I'm Darrell Ezell, Director for Diversity, Equity, and Inclusion at HudsonAlpha. I will serve as the moderator for today's discussion on minority mental health awareness. The purpose of today's Virtual Community Awareness Roundtable is to promote broad community awareness to North Alabama's minority population on key mental health challenges and services. Our discussion will be led by three goals. Number one, explore mental health access impacting minorities. Two, identify counseling opportunities for youth and adults. And three, we want to provide a set of resources to support closing the mental health access gap. So today, we have with us an esteemed panel of practitioners and advocates for mental health wellness. So to start us off today, we have Jeremy Blair. Jeremy is the CEO of Wellstone, North Alabama's largest behavioral health provider with 400 employees serving 11,000 clients per year. Maggie Minks is a licensed clinical mental health counselor in North Carolina, a licensed professional counselor in Alabama, a nationally certified counselor, a certified instructor with the National Guild of Hypnotists, and a certified clinical military counselor who is also intensively trained in dialectical behavior therapy. She works as an independent contractor for The Balanced Life in Madison, Alabama, and teaches workshops and gives presentations at conferences around the country. Thank you so much for being with us, Maggie. Up next, we have with us Trina McCulley. Trina is a school counselor at Sparkman Ninth Grade School. She is finishing her 16th year in education and her 6th year as a school counselor. Willie Bell is a licensed professional counselor at Restore Counseling Services in Madison, Alabama. We want to thank each of you all for being with us today. And let's go ahead and jump right into it. A healthier Alabama is a stronger Alabama. Mental health does not discriminate, and that is why access to care should not. According to the National Institute of Mental health disparities remain a persistent public health issue in the United States, particularly for underserved populations such as racial and ethnic minorities, sexual and gender minorities, individuals from lower socioeconomic strata, or those residing in rural or frontier geographic areas. In recent years, studies as the National Institute for Mental Health Strategic Plan for Research highlight that the reduction of disparities and the promotion of mental health equity as a priority, through emphasis on research that addresses the needs of underserved and underrepresented populations. The Minority Health and Disparities Center at the University of Alabama at Birmingham highlights that one way to build healthier communities is through early access to mental health resources, strong outreach programs, and community partnerships to eliminate health disparities. Another step, the 2018 National Healthcare Quality and Disparities Report suggested that while some disparities have gotten smaller, several disparities persist, especially for lower socioeconomic and uninsured populations. And that for racial and ethnic minorities, disparities remain worse in key quality measures. So it's important that we break the stigma around mental health, provide resources, and offer a bridge for help. Let's jump right into it. Maggie, please start us off by helping us to understand better what trauma is and how it contributes to mental illness.
Well, trauma is an emotional response to a serious incident like an accident, rape, natural disaster, death of a loved one. And it's an emotional response that isn't fully processed. And so when that happens, the body can move into shock, and psychologically we can move into denial. And if not taken care of in terms of getting counseling and getting help, then it can result in what we call post-traumatic stress disorder. I think what a lot of people don't understand, though, is that we can bounce back from trauma, and that more often than not we do bounce back, especially with counseling, especially with help, into what we call post-traumatic growth, where because of resilience and optimism we can grow stronger because of processing and dealing with these things that happen to us. And so it is important to make sure that we get the help that's needed. And I think along those lines, one of the things that I wanted to point out about trauma is that trauma is very personal, and we don't get to decide what's traumatic for somebody else. One of the things that I talk about often in the presentations that I do is sort of likening trauma to potato salad, in my potato salad story. So in that my daughter was about 6 years old when I made this potato salad for the first time, and she'd never had it before, and she ate 2 helpings because it was really good. It was like German potato salad. And we didn't know it at the time, but she was starting to get really sick. And so she ate the potato salad, and then she started just vomiting profusely, like everywhere. And she had never thrown up before, and so she was terrified. And she kept saying, like, I don't want to throw down, I don't want to throw down. And I'm like, well, it's throwing up. But she, she didn't know. She thought she was going to die because of this potato salad. And so after that time, it was years and years before she would eat potato salad, because in her mind, it had created this trauma for her that she was going to die, right? So who's to say potato salad isn't traumatic? Anything can be traumatic if you think that yourself or a loved one is in danger, right? That it creates this physical response in us. And it's important for us to process through that and to talk about it and put words to it so that we understand what happened and how our body responded. And when we don't process emotional stuff during the day cognitively, what happens is that at night we process it during our sleep, and so which causes us to not get rest and etc. So trauma can be anything, right? As long as it creates this fear inside of us and impacts us at this deep, not only psychological, but emotional, mental, physical response.
I want to stay right there with respect to trauma and PTSD. We all have gone through, over the last 2 years, a very traumatic experience, the pandemic. And switching gears just a little bit, Jeremy, I want to pull you into the conversation in thinking about PTSD and also trauma. How has the fallout from COVID-related conditions been detrimental to our collective mental health as a whole?
Well, I think first of all, we realized that we need social connection. That was one of the biggest things that was taken away from us early on in the pandemic with social isolation. And we really realized we need other people. And so I think that has been both detrimental but also a positive because we as a society were getting very isolative in a lot of things that we were doing in our practices. So, when you think about that, it's both a positive and a negative. But also, we're still early on in seeing the impact on our children and adolescents and what this pandemic will probably do, not just in education loss, but in our social emotional learning and social emotional development. There's probably some years that have been lost for our kids. So we've got to work harder to restore that and make sure that our kids are continuing to progress, in a timely manner on those different milestones. When you think about a kindergartner who for 2 years didn't see facial expressions and what that does to their development, especially those with maybe some speech impediments or speech issues. So, there's a lot of different things that we're still really, even though we feel like we're behind the pandemic in so many ways, we're really just at the beginning stages in so many different facets of this. And so I think time will tell in terms of that impact. But we also know that suicide rate among girls especially went up 51% during the pandemic. Even for boys, that went up as well. ER visits for suicidal ideation, depression, anxiety for children and adolescents skyrocketed. You can ask anybody who works in Huntsville Hospital ER, Crestwood ER, how much their business has increased as a result of the pandemic and still even today. And so we're continuing to deal with that. I think we will deal with it for many years to come. But I know that as a result of the pandemic, one of the things that has been, again, a positive is that we've realized our own humanity in so many ways. And we understand, and hopefully at least a little bit, understand that the stigma of mental health will begin to dissolve just a little. Because I think those who probably never thought they would encounter mental health challenges encountered them over the last couple of years and realized that mental health is health, and that we all are going to experience these times where we may not feel right or feel normal or feel okay.
Jeremy, I appreciate that. Thank you. I want to circle back around with the topic around processing pain in just a bit. I want to switch gears. Willie, talk to us a little bit about the challenges. What challenges do socioeconomic disparities present to minorities and marginalized individuals in their efforts to access mental health therapy?
Traditionally, the minority communities did not seek treatment or therapy because there was no example. As I grew up, I don't recall anybody who went to therapy, or you only went if you were crazy. What is crazy? There's no definition for the word crazy. You have abnormal adjustment to things, and then you need to seek treatment for that. But I think what we need to do is dispel some of the myths as far as what is a mental illness. There's any mental illness and there's serious mental illness. And if you don't have one of those serious mental illnesses, you're not going to seek treatment. Or again, traditionally, you got the patriarch of the family or the matriarch of the family kind of leading and guiding everybody, and that's who you went to. Big mama, grandmama, granddaddy, pop, you go to them, they sit you down, they let you know what's going on. Or in the South, just pray about it. And I'm praying about it, but I don't see any results. So then what do? And since the pandemic, I know in private practice, telehealth has grown drastically. So now you can reach out to those rural communities or those areas that don't have any doctors near. Because if you have to drive a certain distance, that costs money to drive to the therapist, and then we have to get somebody to bring you back. So as we grow and develop technology-wise, that helps kind of close the gap, but at the same time, I think just educating on what mental illness is, and at the same time, what insurance covers. And I think Mr. Blair mentioned, you look at the insurance parts of it, you take the holistic approach, but I have clients walk into the practice and I ask what their copay is. They don't even know what the copay is. So you have to learn and understand what is covered under insurance, what your copays are, how much they're gonna cost you. Teaching life skills as far as budgeting and everything else, because I grew up and most people around me thought that only a certain person with wealth sought therapy or went to treatment, but that's not the case. So everybody can be covered and can get help if they know how to seek help.
That last part right there, I want us to kind of unpack that a little bit and go a step further. The fact that if anyone wants help, they can get help. Because in a number of these marginalized spaces, the idea is that help is for other communities or for higher socioeconomic, strata, what have you.
Hotlines, you can go to the Google. A lot of kids are technologically advanced. My 6-year-old, he can run a computer like nobody's business. So you can Google information. technology-wise, have hotlines, just getting out there, walking in the clinic sometimes, contacting the local mental health centers, and word of mouth. I know somebody that can help you with that, so maybe you should call them. So traditional ways to seek therapy, and well as technological advanced ways in seeking therapy.
Maggie?
I was going to say along with that too, Willie mentioned something about kind of feeling like, well, I can't go because, or I shouldn't go because it's not bad enough, right? Like only people who are crazy, or if it's really bad, then you go. And I teach crisis survival skills and problem solving, and one of the things we talk about is the importance of practicing those skills when it's not a crisis, right? Practicing any of those skills. I mean, you wouldn't, for example, try to set up a tent that's brand new at night in the middle of a thunderstorm, right, for the first time. You don't want to do that. You want to put it together maybe in the backyard in the middle of the day where you can see and figure out where everything goes. And then if something happens and it's raining and dark and you can't see, then you know what to do. And I think the same thing with mental health services. Like, don't wait until it's a crisis. You want to go in and work on stuff and kind of learn some skills and process things before it gets really bad, just like with physical health, right? You don't want to wait until your leg falls off before you go to the hospital. If you're having an issue, then you go. And maybe they tell you, it's okay, or you go for a couple times. But I think anybody can get counseling at any time, right, for any reason, and I think we can all use it at some time or another. Not everybody gets it, but everybody could use it at one time or another. I think it's important to get it before it's a crisis, and so then when you're in a crisis, it doesn't seem so weird to go to therapy.
From a policy standpoint, I know people need to realize that there are parity laws that are on the books, meaning that your insurance should cover your mental health at the same level as your physical health. So whether it's a Blue Cross plan or any of the other plans, they're mandated by law to cover those treatments. So that's number one. Number two, always amazes me, Wellstone's been around for 50 years, but a lot of people don't know we exist until you need us. Or they have a misconception about what we do, who we serve. In this day and age, there is no reason why somebody shouldn't be able to access care. It's just a lot of times people don't know the pathways. And so making sure that you are aware of those pathways, whether it's sliding fee scale if you don't have insurance, or whether it's Medicaid, Medicare, or the commercial insurances. There are so many providers, especially in our area, that are willing to help, whether they take cash or whether they take commercial insurances or sliding fee scales. So it's very important to be able to educate yourself first, but then help others around you as well.
I want to pull Trina into the conversation here. Maggie, I hear you with regards to exercising the wellness muscle in a sense. Don't wait until there's a crisis in a sense. Figure out where to go. I'm hearing crisis hotline also. I'm hearing checking with your insurance provider, even if you don't have insurance. Identify the sliding scale opportunities that are in our community. But let's talk about youth and students, Trina. Many children and youth want to feel well liked and included in a group, which can sometimes make them susceptible to bullying and peer pressure. What types of mental health promotion and substantive prevention are often available for students in our school systems?
So as far as the school goes, the school counselors at the beginning of every year do a needs assessment. So that needs assessment is not only asking educational questions. We don't just want to know, do you want help planning the next 4 years? We want to know how their mental health is. It's become even more noticeable since the pandemic, since they came back to school. We have even more students who are seeing mental health professionals. I want to know, are you seeing outside of school therapists? One of the questions on my needs assessment is, do you need to see a therapist? Because on campus now, we are offering services from NOVA as one of our partners and the Enrichment Center. So it doesn't matter if a student has insurance or not, but helping the parent realize that those services are available at the school. On a daily basis in the schools, we're using an app called Rhythm. And it creates a dashboard. So the students are answering questions about their emotional needs. Are they hungry? Are they angry? Are they upset? Did they have a bad morning? And they can leave notes. And that creates a dashboard for their teachers, for their counselors, for their administrators, and it's called a tempo for the school for the day, so that we kind of see, are we low today? Are we going to have more, mental health issues? And then school counselors are not mental health professionals, but we can help parents get in touch with the resources that they need, and students, especially for us, since students can make their own medical decisions at 14, they can come in even if their parents are not open to therapy and be able to receive those services at school, which means that all of our students can be served instead of just a limited section of the population. Oh, you don't have insurance, then you can't be seen. We can put them in touch with those resources. So I have students who do teletherapy in the office with an outside therapist. I have students who see NOVA. I have students who see the Enrichment Center, and we're constantly, making new partnerships so that we can serve every student.
You mentioned parental education, making sure that parents are more aware, taking that a step forward. What are some of the activities and actions that are taking place in the school system to educate parents a bit more about it?
So during our registration process, we have lots of parent activities where I do Google Meets, where they can come in and we discuss all of the resources that are available at the school, so that they know that we have NOVA, so that they know that we have the Enrichment Center, that we have a school social worker that can help them get in touch with different resources as well, and that, if they're at a loss as to what to do, they can always call me, and the school counselor in any school can put them in touch with resources that are available. We want to be that touch point where if we may not know the answer at the time, but we can find out, because we don't want them to go without the care that they need.
That's a good one. That's a really good point, Trina. Maggie, I want to switch gears and think about non-traditional approaches. How does taking a holistic approach support your clients in working through trauma and mental illness to communicate more effectively?
Well, so taking a holistic approach means really looking at the person or the patient, the client, as a whole, as opposed to just looking at the symptoms and treating the symptoms, but instead looking at the whole person and everything that's going on with their life, including emotional, physical, mental, spiritual, and in terms of counseling, working to help them especially prioritize the chaos often, and then problem solve and work to figure out, instead of just kind of trying to put band-aids on the crises in their lives, recognizing that, if you're having crisis after crisis after crisis, right, it's not a crisis, that's your life, and it's time to do some problem solving and to make some changes. And so counseling helps with kind of looking at all of that, and often we're in connection with other providers who do the medical, or who do the prescriptions, or who do, right, and working with them to help the client as a whole.
So operating and working with the whole person,
right,
as opposed to just a section.
And if I can jump in, to include financial health, because if you're not financially healthy, it creates all type of stress and anxiety, which leads to different behaviors, different types of adjustment disorders, because even teenagers want to get a job and make money. But if you don't know how to manage that money well, it just creates this constant need to try to make more money, which impacts physical health, emotional health, or lead to maladaptive behaviors to gain that money. So I also add the financial health into the holistic approach of treating the person.
Jeremy, you mentioned briefly a piece on suicide, but I want you to pick up with that point in just a second. Willie, according to the Center for Disease Control and Prevention, suicide is the 12th leading cause of death for both Hispanic and non-Hispanic people of all races in the United States. What are the early warning signs that friends and loved ones should look for in someone who may attempt suicide?
It can vary individually. I think Megan mentioned earlier that trauma can be different depending upon who's experiencing it, and you can't tell a person how to deal with a certain thing. individuals adjust differently to different situations, but there is a subset of behaviors to look for, sudden changes in behaviors. If I'm quiet and reserved, and that's my norm, then all of a sudden I'm loud, boisterous, easily angered, upset. So you got to take note of the individual, look for the changes, and just say something about it. Don't just ignore it and say, oh, they'll get over it, they'll be okay. I think awareness, identifying, and not being afraid to actually go to a person, ask them what's going on, or not wait too late and go ahead and take them to a counselor or a therapist, and so that they can get a better understanding of what's going on and how to manage themselves so that they don't use a permanent solution to a temporary problem.
And I think that's, a lot of people are afraid to say the word suicide.
Correct.
That is a common misconception. If you ask somebody if they're suicidal, where you're putting the idea in their head. I mean, if I have a student who comes to me and says they're concerned about their friend, that their behavior has changed, that's going to be one of the first things that I ask that kid. If somebody is concerned about their mental health, are you suicidal? If the answer is yes, do you have a plan? And that's just being straightforward with people, not beating around the bush.
And if they have a plan, go to the ER. Don't try to schedule an appointment with a therapist and then you get put off for a couple of weeks. You need immediate action if they have a plan.
So take action immediately.
Take action immediately. Yes.
But I think along those lines too, if people find it difficult to talk about that, I just had someone this morning say, the S word, right? So I think, and that's the perfect opportunity to turn to a counselor, to get that person to a counselor. So if they're finding it difficult to talk about suicide and use that word and talk about it directly, well, that's what counselors are for. That's what we do, to talk about stuff directly and get at it.
Jeremy, any thoughts with regards to suicide, the rise of girls as well, we were talking about with regards to the pandemic?
I think there's a lot of different reasons for why we're seeing that. There's increased social media use, there's increased academic pressure, again, the social isolation that we've experienced for the last few years. And so it's really a matter of, as everyone's really said, is taking what's in the shadows and bringing it into the light and really talking about it, and not being afraid to have those conversations when somebody may or may not indicate that they're having thoughts of harming themselves. Or if you see cuts on their wrists that are maybe not deep cuts, but they're still there. That can be a sign that that person needs to talk or wants to talk and doesn't know how to express that other than cutting on themselves. So there's different ways that people will express those self-harming behaviors. And so it's just being aware of your child, your son, daughter, or whatever relationship may be, and again, not just putting your head in the sand about it. I think that's, if anything comes out of the last few years, I hope that we will have more conversations about mental health, that we will understand that mental health is health, and that we can really begin to normalize those conversations, just like you would talk to somebody about their diabetes or their high blood pressure, talking to them about checking in with them like the rhythm app, and saying, how are you doing today? Scale of 1 to 10, where are you? I think if we all had those kind of conversations, then we would all be better off in many ways. Whether we have mental health issues or not, we all have stressors in our lives that we tend to bury or stuff down. And so just by talking about those kinds of things, we can begin to kind of stabilize a little bit more.
I like that, a checking in with friends and family, and also colleagues as well. This is a very stressful time as we make this transition. Trina, I want to go back to parents and think about resources for parents. What advice might you offer a parent or parents on best practices to support a student's mental health diagnosis?
Well, I think for parents, a lot of it is we're all so busy. We're running from one thing to the next, and we got, I'd say, worse during COVID because we worked more and more at home, and we're not shutting it off. We're not spending that quality time, and so parents really need to spend, it's not about quantity, it's about that quality time, the distraction-free time, where the phone is away, the TV is off, you're actually having a conversation with your child. Monitoring their social media use, having conversations about their mental health. And I've heard parents say to me and to their kid many times, you know, this is the easiest time of your life. This is so much fun. It's different now. The world is different in and of itself than it was even when I was a teenager. This is the hardest part of their life for them because this is the hardest part they've been through. We know that it's going to get bigger, it's going to get harder. There are going to be, you know, bills to pay and families to take care of and those responsibilities. But at this point, they're facing hard things. They are very stressed, and blowing that off and ignoring the mental health conditions has been an issue that I've seen. I do have a lot of parents who take it seriously, but that's really important to have that conversation, to know that you realize that that math assignment is not going to be the end of the world, but to them in that moment, that anxiety is very real. To have that conversation, to talk to them, to listen without making assumptions. And because, you know, as a parent, most of our parents aren't mental health professionals, but they do need a support system. They need somebody to lean on, to know that you're there. I think that's all that they need. They just need somebody to know that, hey, I can talk to you about this, you're going to believe me, and you're there to support me.
There's a lot of research that shows that connections matter, and having those personal connections with not just your parents, but other adults outside of that really promotes resiliency in children and adolescents. And so I think that's an area, again, that we've got to get back to in some ways, is really developing those connections with adults who can provide that safety and security. Because again, it's about the resiliency. We're all going to encounter tough times ahead, but if we have those skills, then we're going to be better equipped to encounter those. So
we're looking at new core skills, new core life skills to push through. In thinking about that, you know, Willie, we talked about moving from trauma, pain to that of therapy, but for some folks of different marginalized groups and what have you, the whole conversation around culture and cultural competence is a matter of fact. How does culturally competent care improve access to and quality of treatment and services?
Well, I think, again, educating and teaching basic life skills of if you have strengths in one area and you can apply that in various areas of different issues that you may deal with, then it'll help the transition be a little smoother. You continue to gain skills, and then if you practice, like Maggie mentioned, then regardless of what's going on, you're able to do well without any low valleys and too high of a peak. You can just kind of level off and deal with whatever comes your way.
Are we seeing therapists themselves required to take training or classes on cultural competence?
You need to. If not, you're going to be probably turning away a lot more clients and only sticking to a subset, but then that would stagnate the therapist as a practitioner, because you want to be able to serve whoever comes to you without just turning people away because you turn a person away, and then it leads back to, if I'm feeling suicidal and I really needed that help and you just, well, I can't help you, go away, then what good are you doing?
How important is culturally competent, training in cultural competence for therapists today?
Well, it's a part of the curriculum in terms of becoming a counselor. Like, we have to take full classes in graduate school on cultural competence, like a full class. And so I think that speaks to, just from the very beginning, the importance that counseling places on that. And so, and I think that's important to realize too, that if someone is a licensed professional counselor, that they do have that foundation already. And then of course after that, we have opportunities to get CEUs or additional education. And so there are tons of opportunities in terms of looking at counseling in diverse populations and cultural competence. And so there's also, and I think that especially these days, the push to get that additional training just beyond what we've got in graduate school is really important.
Yeah, I know as an agency, we bring in speakers on an annual basis, multiple times a year, to train our therapists on cultural competency, because we know how important that is. Not just that you're going to get it in grad school or that you're going to take some online courses or whatever to satisfy your CEUs, but we want to send the message as an agency that this is important to us. And so bringing those individuals in, I think, hopefully communicates that message.
Well, Jeremy, with regards to Wellstone, working to eliminate the stigma of mental illness we've talked about today is extremely important. Please talk a little bit about your passion to work in a community, Wellstone, that serves those struggling with mental illness and substance use disorder.
Yes, so we are obviously, for me personally, as well as a company, we are really continue to strive to build out our continuum of care. We operate 66 different programs to make sure that we have something that fits any person that walks through our door. Last night we held our Beacon of Hope event, which had 375 community stakeholders around the tables, listening to a guest speaker, and then our report out on what we've been doing. I think the biggest thing that we have that we started a year ago, and we hopefully in the next 3 months will move into a crisis diversion center, and so that's a 25,000 square foot facility, purpose built for adults. Instead of going to jail or the ER, they'll have this option of a crisis center to be able to come and stabilize, because oftentimes when those are in a mental health crisis, law enforcement is the first entity that they're going to encounter. And so we want that law enforcement agency or HIMSI or whoever it may be to have an option other than jail and ER to bring that individual. And so we're definitely passionate about finding those gaps in our community. The other thing we announced last night was there are no child and adolescent inpatient beds in Madison County, which is kind of hard to believe as the largest city in the state. But we worked really hard. We've worked hard for about 4 years to try to bring that to reality. And so last night we announced that we're going to break ground in about 6 months on a crisis, the state's first child and adolescent crisis diversion center. So we'll have 24 beds in Madison County finally that will be able to take those individuals, help stabilize them, and hopefully keep them in the county so they can return back to their families as quickly as possible. HIMSI transports 800 youth a year out of county. Most of those go to Decatur and Decatur General, who does an absolutely fantastic job, but they're overwhelmed. And so the other 400 or so that they can't serve end up going to Birmingham, Mobile, Dothan, Chattanooga, Nashville. And so we think it's time to really be able to keep those folks here and keep those families here. So that's also a piece that goes to the diversity and inclusion in that oftentimes those youth that are having to travel don't have the means and don't have the family's supports to be able to make that trip with them. So they're in an ambulance by themselves going to Birmingham or wherever else. So you can imagine how scary and possibly trauma-inducing that may be. And so, it's important that as a community organization, we continue to push. I spent a lot of time in Montgomery, in January through May. And so we need to continue to bring the resources to North Alabama that our community needs.
Thank you so much for that, Jeremy. As we prepare to wrap up, I want us to please take 1 minute to offer any parting thoughts to our viewers regarding mental health and access to care, or your thoughts just in general. Let's start with Willie.
I think as we started out, in the times that we're dealing with now, you take the pandemic and that's a major life event. So again, in the education aspects of what mental illness is, adjustment disorder is a real thing, and not everybody adjusts the same. So if we can just continue to identify resources that reduces anxiety, that reduces stress, and we're able to adjust better. And having more discussions like this when we can come together and just sit down from various backgrounds and just continue to educate the public and let them know that there are people out there that know what they're doing and can get you the help. And yeah, we're gonna do that and continue, and that'll help. That'll help.
Thank you. Trina?
I mean, I think for parents who are dealing with their students and their mental health crisis, it's important to realize that the school is a good place to start. That if you need a resource, if you don't know what to do, if you're completely at a loss, call us. We're there. There's counselors, there's social workers, there's tons of resources that are available to get parents to the resources that they need to best help their student. And that mental health stigma doesn't have to be a thing, that we're all gonna hit bumps in the road. And that if they're suffering from a mental health crisis, the best way to help their student is to get the treatment that they need as well, so that they know how to better assist and so that they're in a better state to be able to help their student get where they need to be.
Thank you. Maggie?
I think the importance of, again, kind of seeking mental health help before it's time for the crisis diversion and finding a bed and a hospital visit. The importance of really reaching out to counselors, and you can go on Psychology Today, you can find individual counseling, group counseling, family counseling, youth counseling, and there are tons of counselors out there. So if you call one and it doesn't work out, you can call a different one. And even, I think, Jeremy mentioned the importance of connection. The importance of connection in regard to counseling is also very real. And so, even if you get in with a counselor and you've gotten started and you're just not clicking, or your child is just not clicking and it's just not helping, don't give up on counseling. Just go to a different counselor, because sometimes it may take a few before you find a fit where that relationship really, where they understand each other and they can get that help that they need. And again, the importance of doing that before it's time for crisis intervention. I think that there, like you mentioned, Willie, there are also the crisis lines. There's actually a crisis text line that a lot of people might not be aware of, which is just 741-741, and they have mental health therapists that staff that line and that are there to help people if they need it. There's tons of apps out there with anything from, like, there's Super Better, there's Woebot, WOEBOT, there's Finch, there's Headspace, there's Calm, there's Luna. There's so many good resources for mental health in regard to apps right there on your phone. There's tons of books, and there are lots of counselors these days that are on Instagram and YouTube and have their own channels, and so that you can begin learning some of those skills and really educating yourself on kind of what emotions are and what they do and how to deal with them. And again, so we can process the really emotional stuff that happens to us, whether it's something that we may think is small, like potato salad, or something huge like a natural disaster or pandemic. But regardless, we're still working and processing through that, and again, so that we don't get to the crisis point. So,
a lot of good resources right there. Thank you so much, Maggie. Jeremy?
For me, I think it's exciting to have these kind of conversations. I appreciate the forum today. I appreciate other forums I've been a part of this month. My words of encouragement is to not let it end with just the month of May. Let's keep moving these conversations forward. I really do believe that mental health is at a tipping point in terms of us having conversations, it being socially accepted, us being able to melt away the stigma around getting treatment. I really do think as our state has moved more dollars into mental health and is really committed to putting the resources behind the treatment of those who maybe can't afford treatment through insurance or other areas, I think we continue to make that progress. And so it's very encouraging what's happening in Huntsville and the surrounding area of North Alabama, as well as the state as a whole. But finally, I would say, to remember that it's okay to not be okay. Everybody goes through stuff at times, and when you go through those things, don't hesitate to reach out, whether that's to reach out to your school counselor, whether that's to reach out to your pastor, or whether that's to reach out to a licensed professional counselor. The key is to reach out and to not just keep that to yourself. And collectively, we'll continue to get better and move things forward.
Thank you so much, Jeremy. And thank you to our panelists today as well. We here at Hudson Alpha would like to thank our esteemed panel for this very important discussion. Thank you for your time and your expertise. I'd like to thank our Community Engagement and Diversity Task Force here at Hudson Alpha and our communication team for their planning and support of this amazing panel discussion today. Please be sure to visit hudsonalpha.org/DEI to learn more about this very important topic. Watch the video and download a set of resources to support you in understanding better minority mental health awareness. Until next time, thank you.